Welcome to the Great America Health Alliance. Today we have a candidate running for Senate in the great state of New Jersey, Alex Zdan. Welcome.
Thank you, Keith. Thank you for having me on.
Of course. We wanted you on because health care is a big issue this cycle. What are you hearing on the campaign trail?
So the biggest issue that I'm hearing from people about is affordability, but the biggest subset of affordability is health care. Far too many families are one major medical expense away from total catastrophe. And that's why I'm glad to see initiatives led by Republicans coming together to make healthcare more affordable for every American. Think about it this way. We've tried to repeal and replace Obamacare for 15 years. And the other side has always said to us, where's your plan? Where's your plan? Well, we're putting the plan together. The Great American Health Alliance, the Great American Healthcare Plan, that's the plan that the U.S. Senate and the U.S. House need to pass today to make sure that Americans can pay for their own healthcare and have choice doing it.
So you're actually running, asking Congress to do something before you're even elected. They could deliver this.
No one will be happier than me if this is not an issue by the time I reach the United States Senate next January. But the fact of the matter is affordability due to healthcare costs is dragging down the financial fortunes of every family across America, especially veterans and those who are in unions. And I think that these healthier savings accounts that are being proposed are absolutely the way to go about it. Think about it this way. When I worked in media, I was lucky enough to have a health savings account. Pre-tax money taken out of my paycheck before I paid a dime of taxes, put into an account so that I could use them for medical expenses. I didn't have to touch my deductible, but I had that money available whenever I needed it. Why shouldn't every American have access to these healthier savings accounts? It's vitally important that we pass these.
Well, health and wellness seems to be what mothers and families are dying for. They really want to be able to use it. Right now, they can't use a lot of this money tax-free, as you were mentioning, even from your accounts. They're used for deductibles, but not necessarily health and wellness. The plan is to expand that, and I assume that's something you fully support.
Absolutely. I mean, we go back to Obamacare, right? $29,000 for the average American on Obamacare. $10,000 of that go to a deductible. Do people who are hardworking blue-collar men and women have that at their disposal in their bank account? No, they don't. They don't. So we need to give those families a boost, a helping hand to have them care for their own children and their own people. And by the way, GAHA is about letting people have their own decisions made for themselves. Trust and respect of individual decisions is a cornerstone of the MAHA agenda, something I'm very supportive of. That's exactly what this healthcare plan would do.
Well, there's a lot of the health freedom movement that actually was born out of the state of New Jersey. How would this help them in their quest to control their own health care decisions?
Well, you're absolutely right. The MAHA movement is very popular in New Jersey. When you look at the polls, it's popular across the country. 70 to 80% of Americans want more decision-making ability over their health care decisions. So how would it help New Jersey? New Jersey is a big-time union state. And unions, people who are in unions, are not allowed to have these savings accounts inexplicably because why? The government says their programs are too good. I think that this needs to be expanded so that healthier savings accounts can be available to union members. New Jersey loves its veterans. Veterans who are on TRICARE don't have access to healthier savings accounts. Again, inexplicably, this is what the government has decided. By expanding that choice to veterans and unions and families, this could be an incredible game changer for healthcare in New Jersey.
Let's talk about price for a second.
Let's talk about it.
This is a fifth of the economy, and you can ask your doctor, you can ask your hospital, you can ask anybody, what is the price of this procedure? What is the price of this service? And they can't seem to answer the question.
Well, yeah,
what do you think about the mystery of pricing in healthcare?
It's unacceptable. Didn't Stephen Brill write his book, Bitter Pill, where he talked about Kleenex being mucus recovery systems that were $70 a box? I mean, this healthcare is in a large sense a black box. People who get these massive bills from hospitals or from their doctors, they have to pour through it. They just want their loved one to get better, instead of having to go through these bills and haggle over pricing. So transparency is vital. Trump RX accounts already are doing that. The president has made sure that prescription drugs, the transparency in how much they actually cost is getting out there. But I spent a career as an investigative reporter fighting waste, fraud, and abuse. There is so much waste, fraud, and abuse in the healthcare system from the healthcare companies. It's time that it gets ferreted out. Vice President Vance is working on that, but we need to give him more ammo so he can continue that mission.
Well, let's talk about your opponent for a second. The sitting senator, he shut the government down for Obamacare subsidies.
Correct.
As you mentioned, were $29,000 or so per person with a $10,000 deductible. What's his plan for lowering the cost of healthcare or empowering people?
His plan is to go on a book tour and make himself money and then run for president, and then maybe he'll get around to fixing things. I'm shocked that Democrats who shut down the government in the fall, they told us over these subsidies, ever since the government reopened in November, just so happened to open a few days after the New Jersey governor's race, but we'll leave that there. Once the government reopened, where were the plans from Democrats on how to fix Obamacare long term? Yes, we extended the subsidies, and I understand that people were very frightened that their health care premiums were going to go up. I don't blame people for being scared about that. But where's the plan from Democrats to fix Obamacare permanently? Obamacare was billed as the silver bullet that was going to make health care affordable in America. It turned out to be a Band-Aid. It's time that we rip the Band-Aid off and do something sustainable that is going to heal our nation and fix health care once and for all.
Well, thank you for joining us today. I really appreciate it, and good luck on the race and on the campaign trail. Come back and see us sometime.
Thanks, Keith. I appreciate it.
Please follow our movement. You can follow us online at thegreathealthalliance.org, and you can follow us on social media at the Great American Health Alliance. For more information, follow us on this very important year to get Congress moving.